All right. So welcome everybody. I wanted to let everybody know that we will be recording today's session. Our plan is to share it for those that are not able to participate. We know that pediatricians and pediatric professionals often have a challenging time carving out just the extra time for sessions like these. And so we have a number of folks who are interested. So we will be sharing it, and it is recording now. I will introduce myself, and then perhaps we can take a few minutes and kind of learn who's around the Zoom room. But my name is Ellen Brilliant. I'm the Executive Director of the American Academy of Pediatrics, Colorado chapter. And we are really excited to be working with CDPHE, the Colorado Department of Public Health and Environment, and Cavity Free at 3 to talk today about oral health. And with that, I am going to turn it over to Reed really quickly for a quick introduction of herself and maybe just a little teaser on Cavity Free at 3.
Hi, good morning, or I should say good afternoon, everyone. It's good to see your faces. I hope you enjoyed the long weekend. Thank you for joining us. I know it's hard. You're always catching up after more than 2 days off. So I'm really excited today to be working with Ellen. She's going to be our glamorous host, interviewing two very experienced pediatricians, Dr. Littler and hopefully Dr. Braun, who will be joining us shortly, about oral health and what they've experienced implementing oral health in their pediatric medical setting and their well child checks. And being really, hopefully this could be a very candid and open conversations about what those barriers have been and inform the work that I do here at the health department. So Cavity Free at 3, Becky Sarniak on the call is also involved in the program here. It started off a long time ago as a training program for medical providers and has grown to a more comprehensive training and technical assistance program for implementing pediatric oral health in the medical setting. And we've come a long ways, but we still have a lot of work to do. So we love to hear how things are going for you in the field. And I'll talk a little bit more about the programs and specifically about some of the incentives and ways to leverage and make oral health work in your practice in terms of your business case and getting requirements and that sort of things out of the way. So I'll talk a little bit more of that after we do our interviews. But really happy to be with you all today and talk about something that's really important. We say it all the time, but the mouth being connected to the body and addressing this important issue with kiddos. And thank you for all the work that you do in your practices. So I'm looking forward to hear from all of you.
Great. Thank you so much, Reed. And since we are an intimate group, we are hoping that we can just learn a little bit from participants in terms of what you hope to gain from today's session. So if folks are comfortable, we are happy to see you eating your lunch, taking your walk, being on your elliptical or treadmill, but we would love to just hear from folks sort of your interest in today's session. So perhaps Megan Steiner, I can start with you, maybe your name, where you're zooming in from, and what interests you about today's session or what you hope to gain.
My name is Megan Steiner. I'm a pediatrician at Western Colorado Pediatrics in Grand Junction. And I've actually gotten to take a part of Dr. Littler's Cavity Free at 3 with our office. And I'm here to support Dr. Littler, but also maybe to give some feedback about, I know I definitely wax and wane. On weeks I do great and every kid gets fluoride, and then other weeks, I don't know, things are stressful, the hygienist isn't in our wing, and I'll like forget the whole week. And so part of this is a helpful reminder for me to continue to do what I've been doing.
Great, thank you. And then Colby, are we able to hear from you?
Sure, here, I don't mind turning my camera on if I can figure out how. Oh. I'm at my house. You might hear my kids in the background. My 7-year-olds are running around playing the guitar. I practice at Grand River Hospital, which is between Junction and Denver, about 3 hours west of Denver. I did the Cavity Free at 3 training years ago, probably, I don't know, 10, 15 years ago. And I sort of like championing oral health. I give talks at our hospital about fluoride and tried unsuccessfully to get them to fluoridate the water in the small town where the hospital is located. But it's a new city council, so maybe we'll try again.
That's great. Good oral health champion. And then Madeline.
Yeah, so I actually am tuning in from Seattle, Washington, and I run a similar program here in Washington State. And so I'm friends with Reed and Becky, and just wanted to share in this process with you guys, because it's we're trying to do it out here as well, and we have our challenges as well and our successes. So we're all trying to put them out back in the body, and it's fun to collaborate on it.
Thank you. And then Becky, if you just want to introduce yourself.
Hi, I'm Becky Sarniak, and I am the Cavity Free at 3 program coordinator, and I work with Reed and Madeline at times too. So pleasure to be here. Thank you for having me.
Great. Thank you. Thank you. So let's go ahead and get started. I saved our last introduction for Cassie Littler, who's one of our featured speakers today. So Cassie, what I thought you could do is introduce yourself and how and why you chose to become an oral health champion in your practice and in your community. And then we've got some questions to go back and forth to learn from your experience and for some of your challenges and any pearls of wisdom that you're willing to share today. So Cassie, if you want to do your introduction and how you came to this work.
Sure. Thanks for having me, you guys. So I'm Cassie Littler. I'm a general pediatrician at Western Colorado Pediatrics in Grand Junction with Megan. And I think, the first time I'd heard about Cavity Free at 3 was in residency. I was in Iowa at the time. And so that was just one of the things that, we would learn about there. And I'm pretty sure a lot of the residency programs now have Cavity Free at 3 or a similar type training in their, throughout their training. And I just felt like when I came to Grand Junction, they'd tried a few times to kind of start a Cavity Free at 3 program, but it just never really took off. Just kind of thinking about cavities as, as our dental hygienists say, the most chronic common disease of childhood. If you think of it more of as a disease prevention instead of just something that you go to the dentist for, then I think that's kind of puts it front and center for pediatricians to take care of. And I think the other thing that was just so surprising to me was the number of little itty bitty kids that were coming in for pre-op surgery, dental, clearance. And I just thought, gosh, these 3-year-olds are coming in and they're going to get general anesthetic for something that's completely preventable. And so that kind of was a big reason why I wanted to try and really make Cavity Free at 3 more of a sustainable program in our practice instead of just something that a couple of us do here and there. So that's sort of how it all started. And I think hopefully Patty will be able to join us because she's just such a force and such a champion for oral health in pediatrics. And I think hearing her speak and just her passion it just kind of inspires you to do something in your practice. So she came and we kind of started, I think she did a training for us one of the first years that I was in practice. We had invited her to come and we had our whole practice front office, back office, providers, everybody was there. But it just kind of didn't quite take off because there wasn't someone to just kind of champion it and push it along. And so we've done trainings over the years a couple of times, but I think this most recent training was because we really have some back office nurses and MAs who are really interested in, in the care of our children in our community. So I think that's the biggest thing that I found is that it really isn't just one provider or one champion in your practice that decides to do this program, because that just doesn't really work. I think the important thing is that you have to build a team, and a team who supports each other, because just like Megan was saying, sometimes you're like, oh man, I totally forgot this week to do that. And so we can kind of, remember and tell each other, to inspire each other to continue this work. So that's sort of how I got started doing Cavity Free at 3. And we've also had kind of an interesting opportunity in our practice to partner with our local federally qualified health center, or FQHC, where they have dental hygienists, and they have them kind of co-located in our practice. And so that's been a really important part of this too, is learning from the dental hygienists just how important oral health care is to children and to families, really. And kind of getting, having them around has really been helpful as a reminder, and, to inspire us to do it. Although that was just for kids who have Medicaid or who are uninsured. And we really felt like we wanted to provide this service and this prevention to all of our patients in our practice. And so that's why we went ahead and also implemented Cavity Free at 3 for all kids. So, yeah.
That's great. Thank you. Thank you. So other questions that we have for you, and then also for participants in today's conversation, is kind of like the nuts and bolts too. Like, when you started to think about this, what did it look like, in the context of a well child checked? Is it something that sort of seemed to easily sort of fit into the flow? Did you have to adjust it? Like, what did that sort of look like when you decided that you wanted to offer more of this oral health for the patients that you were serving?
Yeah, I think a lot of providers were worried that it was going to be very disruptive and time consuming, especially to do the oral health evaluation part of it. Nobody likes to click more buttons or put more things in the EHR. But we're asking a lot of these questions anyway. So I think, just being mindful that people are going to be concerned about, you only have a certain amount of time to do a limited number of things, and this is just one more thing to try and fit into your 20 or 30 minute well child check. How's that going to work? But I can assure providers or people that are listening to this that it really doesn't take much extra time, and it's just so valuable of a something that you can do, and you just feel like, man, I've really prevented something here. And I think the biggest tip I would say that helped it to work into our well child check workflow is to get the nurses and the MAs on board, because they're already asking about vaccines. Like, okay, your child's due for this vaccine today. We're going to go ahead and let the doctor know. Are you okay with doing that? And now it's your child is due for this vaccine, and you're also due for a fluoride varnish today. We're going to go ahead and let your provider know that. And that seems to kind of prepare our families to kind of be like, yep, that sounds good. And it's just kind of gives them a step. And so, it makes it a little bit easier, because then when I go in and I ask about, we always ask about fruits and vegetables, and if they're brushing their teeth, and, sugary snacks and sugary drinks, and if they have a dentist that they see, those things we ask about anyway at well child visits. And so it's really not that much more to ask if a parent has had, cavities in the last 12 months, or if a sibling has had cavities. It's pretty easy to do. And then in our model, both providers and our back office staff have been trained to apply the fluoride as well. So I don't know, maybe Megan can even jump in and say, but if a family's doesn't need, if a child doesn't need shots that day, then I just have fluoride and our toothbrushes and stuff kind of in my bag. And so I'll just apply it myself. And then if not, if the nurse is going to go in, then they can just go in and apply it as well. So it makes it not that much longer, really. Seems pretty easy.
I would agree. It's been pretty easy. I actually think the screening questions, and maybe this is not allowed, but a lot of times I think I can answer them without necessarily asking the family more questions. I just saw their sibling for a pre-op. I know their 6-year-old sibling has had cavities in the last 12 months. And so I can already pick up those positives for being high risk without necessarily asking any other questions. We're going through the diet. They drink juice all day. They don't drink water. Great. I know that they're getting more than 3 snacks or carbs or juice a day and they're at risk. So I think that to me is just like if you're not asking extra questions, you're just kind of picking up stuff that you're already asking. And then I would agree if they're not due for vaccines, I always feel like the non-vaccinating well child checks have a weird ending when you're like, well, you're not due for anything. And so now it's really nice to be like, hey, you don't have any vaccines. I'm just going to throw some fluoride on your teeth and you'll be good to go. So it's kind of a nice way to like tell parents like we're ending the visit. You've got like 30 more seconds for questions. But I feel like it's solved the problem of like, I just awkwardly walk out and say, you're doing great. See you next year.
That's great. Thank you for sharing. So I'd like to introduce and welcome Dr. Patty Braun, one of our other speakers with us today. And Patty, we went around and did introductions, but what Cassie did was talk about sort of how she arrived at becoming an oral health champion. So if you wouldn't mind just maybe giving us a quick introduction and your background and why, you know, you've chosen to champion oral health.
Thank you so much. I hope that you can hear me okay. Can you hear me? Okay, and I really do apologize for running late. I had a very crazy morning, and so thank you for the patience in getting letting me join. So I think I know everybody. I don't know if I know Madeline, so I'll speak to Madeline a little bit. I'm Patty Braun. I'm a pediatrician, and I've worked at Denver Health now for my whole career. And if you don't know Denver Health is a safety net healthcare system that works with kids who carry the burden of disease, of dental disease. And for my career, my colleagues and I have been looking at bad teeth and wanting to try to improve the oral health disparities that our patients experience. So about, now 15 years ago, I went and became our chapter oral health advocate. We call them COHAs. Each state has at least one. And I do feel like I have been trying to be an advocate for oral health over the last decade or so. And that began with working on our state program, Cavity Free at 3, that Reed is helping and running at the CDPHE. So we helped launch that, just focusing on, okay, how can we leverage medical visits to prevent dental disease and use those early visits, especially before dental disease starts, to try to do some evidence-based procedures like fluoride varnish. That then evolved into training a lot of people around oral health and the prevention of delivery of preventative oral health services. And then we've been working on a pretty cool project called the Medical Dental Integration Project that integrates dental hygienists in the medical care team. And that expands, and Cassie, I know that's been participating, and Megan, I'm curious about you too. But that expands what can be delivered at medical visits and leverages that opportunity to say, okay, we've got a dental hygienist who in Colorado can function and work in a medical office. How can that person even elevate their oral health more? And I'll tell you, of all the things that I do in our pediatric practice, we're all pediatricians, we're busy. There's a lot that we do that's hard. This is one that is not, oral health isn't rocket science. And so to talk about oral health risk behaviors like Megan was talking about, we know that many of our kids are not optimally eating, that they are sleeping with a bottle, that it is challenging for them to see a dental provider. So that's a risk factor. And so it's not hard to find a kid who's at risk, and it's easy to put fluoride varnish on and refer to a dental provider. It's just a simple, easy task. It doesn't add much to the length of the visit at all. It can be delegated to one of your medical providers, and then or to one of your medical assistants. And then it also becomes something that they can do that isn't a shot in making the kid cry all the time. So I've been the chapter, or excuse me, the AAP section on oral health executive committee chair for the last, I'm in my 10th year. I just am now past chair and working really to improve oral health and raise awareness of oral health across all of our states. And so, and we're getting there slowly. So I'm eager to see who's on the call today and hear about questions you might have to move this forward with us together.
Great,
I'd love
thank
to-
you.
Yep, I don't want to reintroduce. I don't want people to have to reintroduce themselves. I know everybody. I just love to know who Megan is and who Madeline is. And I don't know, are there callers on the phone that are not Zoom, that are not?
Yeah, we can see everybody, so we can do a quick intro
Okay,
if Megan wants to do that, and
Yeah.
Madeline real quick.
I'm sorry.
Yeah, I'm Megan Steiner. I work with Dr. Littler at Western Colorado Pediatrics. I'm one of the pediatricians. And I do love our medical dental integration hygienists. They're lovely. I think their program works really well. And I feel like from the time I started here 4 or 5 years ago, I am now got my families on their second or third kid, and they've seen the dentist by one. And I very much know that's not because I told them to go to the dentist so many times, but because they like know that our hygienists are here. They expect our hygienists to come in. And I think they hear, it may be the same message that we say you have to go to the dentist once you have a tooth, but I think having a hygienist walk in who's got the expertise to tell them that is even more convincing. And so I would love to talk to our FQHC because I anecdotally feel like we've improved dental health in the Valley with our medical dental integration, but I'm curious if there's data to back that up.
There are. You need to have repetitive visits to get kids in. One visit doesn't make a difference, honestly. But once you start to get kids in for regular preventative visits, and there's enough of those visits, then we are seeing improvements in the oral health outcomes, which is really great.
Great, thank you. And then Madeline?
Yeah, I just chatted you, Patty. I'm from Seattle, and I'm
Yeah,
just,
hi, Madeline. I see you better now.
yes.
And then I know Julie joined us late too. So Julie, I don't know if you would like to introduce yourself, but we are an informal group and just information sharing. Okay. So then let's
Oh,
go
there,
on
I got it.
Oh, there you are. Okay.
I'm Julie Cordova. I'm with Parkview Pediatrics. And yeah, I'm just I'm sorry I'm joining late, but I just wanted to get what information I can in the rest of the time.
That's fantastic. So Julie, are you guys offering oral health services currently?
We are starting a collaboration with a dental hygienist, but we're still in the very early stages of that, but we're trying to make that work for our patients. And then I have a couple of providers who used to do cavity free at 3 and their old practice. And so again, that's why I'm kind of listening in.
Fantastic. So thank you. So, for purposes of today, we've got some folks who are doing this and are pretty seasoned at doing it. And then other people who are on various places in the continuum. So it's a great place to throw out questions and challenges, which we'll get to in just a second. Colby, I wanted to check in with you as well regarding your experience. I know you were talking about on the advocacy side of things and working with City Council in terms of fluoride, but how does it look day to day in your practice and the responsiveness from your families, or where are you at on the continuum?
We participate in the Cavity Free at 3 program. So we do fluoride at our well visits starting at 6 months. And we try to advocate for kids to get into the dentist. I would say there's been reasonable uptake for that. We have a good pediatric dentist in town and several family dentists who see small children. Counseling on lifestyle changes is always difficult. And so, we've made what headway we can with talking to people about dental hygiene and specifically diet related to dental hygiene. I feel like is a really tough one to get people to change.
It's a great point.
Oop, sorry.
If you need to get that, grab that. And then I would just say, for Cassie, when you're hearing kind of that challenge, how do you work with families and how do you, respond to that kind of situation, or what advice might you share there?
Yeah, I think just like, we've been saying is that over and over again, if you hear things over and over again, you're more likely to pick it up, right? So we start talking about it when they get their first tooth, or the dental hygienist will come in at 6 months, even if they don't have teeth, just to kind of talk about the importance of oral health care. So just continuing to do it at every visit, and maybe they don't want fluoride this time, but they'll do it next time. The other thing that I wanted to kind of jump onto with what Colby was saying is that she has a good pediatric dentist in the area. And we also have plenty of really good pediatric dentists in our area. And I feel like sometimes the medical community doesn't want to step on toes of the dental community. So we don't want to necessarily put fluoride on if they're going to get it at the dentist, or families will say that a lot too. Like, oh, I'm going to go to the dentist in a couple of months. I probably don't need fluoride today. And so kind of, getting rid of that myth that you only need fluoride twice a year. That's been a big help in our practice to kind of say, and even to our back office staff, just saying, oh no, that's okay. If they've had it 2 months ago, it's actually really important to have that extra fluoride for someone who's maybe at higher risk. And so helping our providers to understand that, and also just working with the pediatric dentists in your town. I think when we initially had our dental integration, there was a little bit of a I don't know, something with the codes when the dental hygienist would put them in versus being at the dentist's office. But we just worked with our dentists in the valley, and now it's no problem at all. And they really value our dental hygienists seeing patients because they'll get referrals earlier instead of later when things are really, really bad. And I think too, our dentists will come over, and we haven't in this last year just because of COVID, of course, but we've had them come over and show us pictures and, dental anomalies, and just do some good teaching from the dentist to us. That's been a really a positive experience for our providers, I think, as well. So making it more of a collaboration with the pediatric dentist instead of kind of, having separate turfs makes it a positive change in the community. Does anybody else work in your community with Julie or Colby with the pediatric dentists, or I don't know?
And I'm just I love that, those anecdotes, Dr. Littler, that's perfect. I also think that, we did focus groups of families of who had dental disease and who did not have dental disease. And what we learned from that is that parents really care. And if we can give them the knowledge around oral health disease, that they often can elevate their response. And but I know that I didn't learn in my medical school training that dental disease was preventable and that it was an infection and these bacteria feed on this carbohydrate. So you had asked about how to motivate parents to change their behaviors, and I have experience, and there's evidence to support that some education around dental disease helps motivate them to some to a little bit of a higher level. And then motivational interviewing techniques can help parents identify some goals or what they might be willing to do. And I know we work on that in Cavity Free at 3, and Rita's been pulling in motivational interview experts and has some recordings. I don't know if Rita, if you want to share those.
Yeah, it's definitely part of our model as we introduce, or as we talk about anticipatory guidance and what that looks like, really having person-centered conversations and seeing families as the experts, and thinking about goal setting and letting them prioritize their own goals. So we definitely touch on that in the training, and we've been making updates to our trainings as well, as Dr. Braun said, bringing in Dr. Matt Allen, who does motivational interviewing, and really thinking how we can also reach out to oral health providers and help them have better conversations as well. I think typically pediatricians tend to be a little bit ahead of the curve and understand kind of those motivational interviewing conversations and be able to apply those skills in the oral health field as well. But definitely supporting that. And from an equity lens too, I think is definitely on all of our minds in the past year and a half of just really, seeing patients as experts and understanding the experiences in their lives and all the factors that come into oral health disease. It's not just like, oh, you didn't brush your teeth. There's a lot more going on. So recognizing the complexity of those risks, but also empowering patients to, figure out what's going to work for them to improve their kids' health, which I think they all want to.
Great, thank you. So let's talk a little bit about maybe some of the barriers. I think it's harder when you have a group of champions because you guys have figured out how to overcome the barriers. But Megan, in the beginning, you sort of referenced that it kind of ebbs and flows when you're thinking about it, right? What for you, as somebody who supports this, but not necessarily is you know, an AAP champion by definition of what's written in black and white for a job description like that, but as somebody who supports this, what are some of the challenges for you, or possibly challenges you see for some of your colleagues?
I think that it can be an unpopular topic. So I know I've heard some of my colleagues just kind of lecture about juice, and I don't think that goes well. I think you have to wait for them to say, gosh, they don't take their afternoon nap well. And then you have to say, well, gosh, do they have any juice with lunch? Do you think maybe that juice is giving them more energy? So I feel like there's like, it's the nuance between giving them the facts and then finding the wedge for where they're ready to change. And it may not have anything to do with their teeth at all. But I think the other barrier early on is we did have quite a few parents that were really worried that they were going to get charged if they got fluoride from us and not the dentist. I don't think that's actually come up with anybody, but I think that was a big concern. And so now that we're a year or a few months in, it's really easy to say, like, we haven't had any patients with private insurance get charged. And I think families are very willing to accept it. But I think before then, I think the savvier parents are worried about the charge.
Which, sorry if you don't mind if I jump in, Megan, which really was a concern a few years ago when commercial insurance wasn't reimbursing regularly. But luckily that has changed. And I think that has really helped overcome what was a big barrier, because a lot of pediatric practices have mixed payers. You see kids with Medicaid, uninsured, with private insurance. You don't want to have to think about like, who's going to get charged or who's going to pay, you know, who's going to pay you or not for the visit. So knowing that you can count on, I shouldn't say all, but the lion's share of commercial insurance to reimburse for that fluoride varnish has made a huge difference, and I think has really helped some practices implement recently. For your business case too, right? Like, you can't take the hit for all your private payers. So now knowing that you will get that money and your time will be valued, super important.
And I honestly share, I have a colleague who sits next to me who's got 2 kids, and she has the private insurance that we offer through our office. And she's like, it's cheaper to get fluoride through their well child checks than to take them into the dentist. Because the dentist, neither of them have needed cleanings. They've just been exams and fluoride. And so I know that she's really appreciated it, because she still takes them to the dentist every 6 months, but she feels like we're not doing that much different because she's already brushing her kid. They must not have any plaque on their teeth. They must have pretty good looking teeth. But so I've shared that with some parents to say, like, honestly, it may be a good deal, because if you prevent a cavity, the cavities are going to be what costs you money.
That's a really good point, Megan. I love that anecdote too. We've learned from over time that through the AAP periodic survey, about 18% of pediatricians address oral health and provide fluoride varnish at well child care visits. So it's not that much. And so we've assessed barriers, and inequity in insurance reimbursement has been a problem. Thank you, Reed, for sharing that there's been more parity across payers. But there still needs to be a lot done in that regard to get private payers to acknowledge the U.S. Preventative Task Force Recommendation B, which means that any healthcare plan should include fluoride varnish as a covered benefit in their medical insurance. So there's not really a reason why a medical insurance shouldn't cover it. They often don't know it, and so sometimes there is some education on the provider part or the healthcare system part, of the patient part, to educate them on that it is a covered benefit, as Reed's put in there, grade B, no cost sharing. And it doesn't really take that much time. So, it's pretty quick. We ask oral health questions as part of our screening around diet, sleep habits, etc. So at least personally, I tend not to go down item by item Carrie's risk assessment tool. I tend to integrate the questions in my conversation as I take a history. And that then just becomes a bit more of a natural way to do it. And then fluoride varnish itself is quick and easy. So sometimes the barrier can be creating a functional dental referral because we're not linked electronically, and it can be hard to get a patient to a dentist, but there are things you can do at a local level to try to facilitate those dental referrals.
Thank you, Patty. Julie, as your practice is thinking about doing this, were there conversations around barriers or concerns about the challenges that your practice might face in trying to implement something like this?
I think, like you said, a lot of parents have concerns about fluoride and using that regularly. And, the time it would probably take to educate parents about that, at least initially, until we got the program going. And so honestly, I think that's part of the reason why we are thinking about a dental hygienist, because that will be their sole mission, and that it won't end up tying up our visits. I also think a little bit of the barrier in our clinic is who's going to actually do it. Like you said, is it going to be providers? Is it going to be MAs? And, we've not been terribly busy. That's getting better. But as we get busier, I think also trying to make sure we have the time to actually do it properly was another concern that got raised.
That makes sense. That makes sense. Cassie?
Yeah, I was just going to say that was one of the biggest things in our practice, like I'd mentioned, but it really, like Patty was saying, it really doesn't take much time. And if you think about trying to tell the providers about the risk benefit ratio of taking 1 to 2 minutes to do the fluoride, not even that, it takes like 30 seconds, honestly, to do it. And you're looking in the mouth anyway. And the benefit of preventing, recurrent infections and cavities and anesthesia and all of those things, it's really, the risk benefit ratio is just impressive. And I think, like you said, once you get the program up and running, it really doesn't take that much time. And I'll just mention, since you're thinking about a dental hygienist integration, our back office kind of likes to use them as, if we're running late, they'll send in the dental hygienist because the kids love to have the, look at the mirror and look at their teeth, and they get the fluoride and they get the toothbrush, and it's really fun. It's like a, really positive experience usually for the kids. And so if I'm running late, the dental hygienist will go in before me. So it actually is a time saver sometimes.
I just wanted to speak briefly to the question of fluoride. So as part of the Cavity Free at 3 training, we do touch on how to talk about fluoride with families. And we have some resources like Say This, Not That, and the research and that sort of thing. But it isn't, I wouldn't say it's not an issue. It can be an issue for some families, and not definitely a hill you don't want to die on. But I've also gotten feedback that sometimes families who are opposed to community water fluoridation, if you explain it really succinctly how the fluoride varnish is a topical application, they'll actually be okay with the fluoride varnish, even if they're not okay with the water fluoridation. So you can separate those issues and explain that systemic versus topical application, and use language like it's as safe as a multivitamin for your kid. So we really help with that language in those conversations. And I know that it's kind of scary to walk into, that can be such a controversial topic, which is still blows my mind after 70 years of research, thousands and thousands of papers, but it's still controversial, I understand, in some communities. So I can understand the hesitation about walking into that conversation, but we'll definitely in the training give some tools to make sure you don't feel ill-equipped.
Thank you. So what's interesting to me is it sounds like the barriers are not necessarily internal per se, but really just kind of the interfacing with families and the patients. Is that feeling accurate to folks, that it's less, Julie?
Yeah, I mean, I think it's funny. I think we all, like you guys are saying, we're all pediatricians. I mean, we believe in this. And like you said, I've had more kids get dental cavities fixed under anesthesia than they should. So I think we're all in support of it. I think you're right. So don't think it's anybody fighting it from in here. It's just figuring out how to make it work. And like you said, getting parents to go along. Although it's interesting to hear from me that the training gives you some guidance on that. So like you said, you don't end up getting tied up for 20 minutes talking about all these things. So that's helpful to know that the training gives you some guidelines for introducing this to parents and making that pretty quick and easy to understand. So.
Thank you. Madeline and Becky, just given your expertise from the other side, when you're hearing sort of the anecdotes or some of the challenges or things that have worked, what are thoughts that you have or things that have worked particularly well with some of the practices in which you've worked?
Well, one additional perspective I'd like to add to some of the anecdotes that I've already heard was that pediatrician at one point, a year after I had trained her, I bumped into her at a conference, and she said that one thing that she really liked about doing the oral health with her pediatric patients was that it was a different way of talking about the whole obesity, nutrition, those messages, that she could do it in a less value-laden way, and also just with a new perspective to it, because everyone has heard, you know, potato chips are bad, you know, but this is like a different way to talk about the weight issues that she's seeing with her patients. So I thought that that was a really interesting. I like to share that with the providers that I train. And I love hearing you providers say that this really doesn't take that much time. And I also do hear all the time that I don't have time for one more thing. So that's just continues to be a barrier for folks. And I think once people actually give it a go and do it, it doesn't need to take that much time. As you both have said, it's a lot of it's what you're already doing. But that seems to be a lot of inertia around that. Or out here in the Northwest. But I'm guessing our providers are not that different. So it's an unfortunate storyline.
I really liked Megan's tip about, and sometimes when it's a huge problem with providers around time, we'll start with just like the 9-month well-child visit where there aren't vaccines and there isn't a ton going on, and build confidence and do it just during that visit alone, so that you see that it doesn't take as much time, and you can start incorporating into the full Bright Future schedules as recommended. But I loved her tip of like, yeah, when they don't have vaccines, it's kind of nice to offer them something like, this is the preventative service, this is how I end the visit. So I thought that was great. I think she just jumped off, but I really liked that.
Mm-hmm.
And jumping on that a little, one of the things we talk about is you don't have to cover every single talking point in every single visit, that it's playing the long game and you're talking to them in a conversation over time. It reinforces hearing those same talking points, that oral health is important. And I'm not taking the place of your dentist. I just know that this is also good for your overall health, and building over time those healthy behaviors.
Great, thank you. Thanks. Colby, just to ask you, if there are things that have that would work better for you, like do you have recommendations or feedback in the efforts that you've implemented in your community?
You're asking if there was something that would work better for me about the Cavity Free at 3 program specifically?
Yeah, or just oral health in general and how you guys are approaching it in your community.
I would like to see us implement having a hygienist in the office with us. And that's something that I'm sort of preparing to start advocating for at the hospital where I'm employed. I think that's sort of the next step for us. I do feel like we're doing a pretty good job, with the fluoride varnish in the well visits. I know the other pediatricians and I do that, and we've got a pretty big family practice group also at our hospital, and I think we've really got most of them doing it as well. We have our MAs do it, do the actual varnishing typically, so it doesn't really take much provider time. So that's sort of a goal of mine in terms of a next step. Is anybody using the hygienist in their office to do like the silver diamine fluoride? I've started to see that on the teeth of some of the kids locally, and I'm not 100% sure where they're getting it.
Great.
Is anybody else using that?
Yeah, great question, Colby. Remind me where you practice.
I'm at Grand River Hospital, which is in Rifle, Colorado.
Okay, great.
I think they're getting it at the Mountain Family Health Center locally, but I guess I need to ask one of the patients.
Yeah, we work with Mountain Family, and we do know that the dental providers there do use silver diamine fluoride, and other hygienists as well. And so dental hygienists can treatment plan and apply silver diamine fluoride, and it is effective and a great tool. So, and pediatricians aren't really doing it yet. That's a bit of a different discussion. So it is a nice thing that a dental hygienist can do for a kid in your office, and it sterilizes the lesion. It arrests the decay. It really does halt that disease process. It doesn't fill in the hole, so it's not functionally filling a cavity, but a lot of the time it just buys people time either till the tooth falls out or until they get a definitive restoration. And it's interesting that you're seeing it, and we're all going to start seeing it more and more. It's used to be used more, and it's coming back. We do a lot of, I'm sorry, Ellen, we have a lot of discussion about pediatricians using silver diamine fluoride as a pediatric provider. And there are a few pediatricians in other states that have piloted this and are testing it. The dentists are a little bit mixed about medical providers doing that. So we're doing a lot of diplomatic work, I would say, with dental providers about the use of pediatricians using dental fluoride or silver diamine fluoride and hygienists. But that's a great question.
Reed or Cassie, were you jumping in? I don't know if I saw a hand movement on that. No.
I was just curious, Colby, what else, why else are you wishing to have a hygienist in your office? For the SDF, or were there other things that you were hoping that they could do?
I mean, I would just like to provide better dental care, period, to our patient population. I live in a really high needs, or I guess I practice in a really high needs area, and I see a lot of kids who aren't getting dental care at a young age and end up with tons and tons of restorations. I mean, it's probably the same motivation as everybody else on this talk. Like, you hate to see that when you know that there are things we could be doing to prevent it.
Mm-hmm. Madeline, in the work that we supported Colby, in integrating dental hygienists, we do try to promote them working to the top of their license. And so there are additional services that a dental hygienist can do that pediatricians can do. Silver diamine fluoride's one. Sealants are evidence-based. That's another one. So we see the value if a hygienist is in the office to optimize the services that they can provide that we couldn't.
Thank you.
Our dental hygienists are just doing regular fluoride for now. They've been discussing doing the SDF in our office. And then we tried to do sealants for a while, but I think it just never took off initially, but now we have kind of a stronger program. So I think that's something that is the next step for our dental hygienists. So yeah, I think, being able to be more expansive with your dental hygienist in your office is a great idea.
Thank you. Other questions? We have a few minutes left, and not that we need to go to the full time, but do have an opportunity with some expertise and some others who are implementing to do some information sharing. So Julie, any more sort of digging questions that you've got where you get to leverage the expertise of Cassie and Patty and Reed and Colby and Madeline?
No, I mean, I know I was so late to the program, and really probably the part you guys covered early that I missed was like what the training actually looks like and what that process is and all those things. So I figure I will go back and watch the recording and figure all of that out. So I don't want to ask questions you guys have already covered. So
Well, let
You're
me
totally
touch on that really briefly, because I feel like I only mentioned it briefly at the beginning, Julie. So the Cavity Free at 3 program is statewide. We provide a free training that certifies your providers to bill Medicaid for the oral health services delivered during a well child check. We used to be just a training program, but we've evolved. I think Cassie mentioned one of the barriers that her practice confronted was, if it's just one person trying to take the oral health forward, one advocate, it doesn't work. It really has to be more of a clinic-wide implementation where you look at the team and you figure out how clinic flow works with the team, take a team-based approach, think thoughtfully about where to order fluoride varnish applications, what your clinic flow looks like, how to document in the EHR. So we have adapted to be a more comprehensive technical assistance program around all of those details, and we work with you. So the timeline, the way it would work is we do kind of an initial phone call and then a more detailed checklist where we'd go over kind of every element of how to implement oral health and make sure you're set up for success. And we'd schedule that training. During the pandemic, the training has been virtual. We've missed being hands-on, but it works pretty well. We have a very engaging, we do polls, and we have a healthcare provider that always delivers our training. So you are always speaking to someone that has actually done this and is an expert in it. So we have a 2-hour virtual training to get everyone on board. And then we also follow up with you for a year afterwards and just touch base to get some very basic data from you, just so that you're tracking it and you know that it's working in your office as well. And Dr. Littler has been great providing that data as we worked with her. It's been like really informative. Like I said, looking at those commercial payers and seeing that they really are paying and not having problems that way. So we have a website. You can contact us there. I'll put my contact information in the chat, but definitely reach out. Even if you have some providers who were trained in the past, we could do a refresh training and just get everyone on board and kind of like renew the energy around oral health and, decide on what the standard clinic flow is and all of that. And like everyone said, it's not rocket science. It's a simple thing, but whenever you're doing something new in an office or adding something, there are challenges, and it's good to work with someone who knows what those are and can give you some ideas of how to address those.
And if we chose to have MAs do that, do they have to have additional training as well, or is that our job? After our 2-hour training, we bring them along?
No, they would attend the training as well.
Okay.
Yeah, great question.
So that would have to be the whole staff then. Okay.
So we usually do like an extended lunch hour so that you don't have to take away too much patient time. You can bring your lunch and we get you done with a little extra lunch hour. But we like training the whole clinic, getting everyone aboard, getting everyone the reasons why that we do this. And then some other things that I wanted to mention really quickly. I know we're running out of time here, but like if you need some maintenance of certification for either your pediatric or family physician board, we can also provide that. So those data check-ins can qualify. We have everything set up, like the measures and the PDSAs all ready to go. So if any of your providers need that for their ongoing certification, we can help with that. And there's some other incentives as well financially with Medicaid. If your practice takes Medicaid, like the dental KPI, key performance indicator, you can get enhanced reimbursement rates. And then the clinical quality improvement through the value-based payment as well. So I can talk anyone who's interested through those measures as well, but just so that there are other incentives to kind of help support this work. We're not asking you to just do it out of the goodness of your heart. And finally, I always forget to mention that being trained by Cavity Free at 3 gets you points on your loan repayment application if you're applying through Colorado Health Service Corps. It is very competitive, and so having those extra points can really help you get a leg up if you're applying for help with those loans. So I just wanted to mention those incentives. We had a survey that recently went out, which if you haven't taken it, we'll drop it in the chat box. But that was one of the things people were more interested in learning about those incentives. So if there are any questions, I can field those.
Thank you for that.
Great. I was looking for the survey link, Reed, but if you've got it at your fingertips, okay, so you can put that in. All right. So anything else that Patty or Cassie, you would say for the good of the order for our time together?
No, I would just like to say, working with Reed and the team at CDPHE has been really amazing. They've even worked with our billing office staff to kind of help prepare them for, the changes in billing that we are asking them to do. Any question that anybody has, I'm sure Reed has heard it before and has an answer for it. So I would just encourage people to reach out, and I'm happy to also to chat offline if anybody has any questions about how we worked it into our practice.
I'll just echo Cassie's endorsement of CDPHE and cavity-free A3. Reed is a pro coach and helps motivate teams move forward. And there's so many great resources. So thankfully in Colorado, there's a lot of resources like CDPHE, the Colorado Medical Dental Integration Project. So don't hesitate to reach out. We're here as colleagues and as peers to help move this along.
Thank you. Reed, anything from your end?
No, just please reach out if you would like more information on any of the incentives I rattled off really quickly, or a training, a refresher training, or MOC if you're doing cavity-free at 3, but you'd like to do a little improvement project to get your numbers up. You can definitely approach it that way, or just any other questions that you might have. Please reach out. I have my information in the chat box.
Thank you. And with that, I will thank you all for your time and your energy and championing oral health among your smallest patients, and have a great rest of your day. Take care.
Thanks, everyone.
Thanks, everyone. Thanks, Dr. Littler and Dr. Braun.
Thank you, Reed. Be well.
Thank
everyone.
you.